Hi, good day everyone. Goeiedag almal. Molweni nonke. Today I would like to talk about TB. You will notice on my TikTok page, if you go to TikTok, I will leave the TikTok name. It says the Premier Windy launches a multi-sectoral emergency response plan to reduce TB. So now on the TikTok platform, we already spoke about this response plan and what it is. We encourage people to read the plan. So when we did this, not training, but just facilitating, people through this document. It's 2 pages, but knowing that not everyone likes to read, we don't like to read always. So I took it on me to, go through these documents with you. You will, as I said, I will leave the TikTok page on this platform, so you can go and have a look at the session on there, because I'm not going to go through the whole document. Reason for that being, I'm anxious to get to the part where it's implemented. You remember this plan was made, before the launch, and then the launch happened in April 2021, if I'm correct, and then the implementation phase. So what was said in the document, what was planned, so some of those steps took place. And I'm anxious to get to that phase, because I'm very anxious to get to that phase. That was now the implementing phase as to what else can be done, to reduce TB, to reduce the spread of TB. I remember with the TikTok video, we said that TB has the highest death rate in South Africa due to TB. If the stats are still the same, South Africa is ranking 3rd when it comes to TB globally. 3rd. So let me quickly run through the document and just pause on what I think is relevant now. So with this document that was launched, all stakeholders had to come together. Remember, TB is everyone's business. TB, to reduce the spread of TB, or to stop the spread, or to reduce the spread, we need everyone's help. It's the patient that is infected with TB and on treatment, someone that is on treatment also. It's the healthcare worker, it's government, it's private. Everyone has a role. The person in the community, how to prevent, if he knows what to do, he's going to also play a role. But people need to be made aware of TB. So TB awareness needs to be, when someone says TB, then you must know what are they talking about, or why do they, why do I have to know about TB? But if someone says TB, what is those things, Mutsoma, I don't know what is those things, moet afgaan, if you hear that word TB, because too many people are still dying of TB. TB is a curable disease. TB can be prevented. Why are so many people dying of TB daily? You will see why different stakeholders have to take hands, because TB cannot be managed only by the health department. When you look at your community, TB cannot be managed only by that local, that one clinic that's in your community. It cannot. It's not just a health problem alone. Remember, we said it's everybody's business. It's affecting everyone. TB is affecting everyone. Directly and indirectly. And indirectly, mustn't think like, what, TB's there. I know about TB. I hear of TB, but, it's not close to me. No, it has an impact. If everyone gets sick with TB, I cannot go to work. If you're the owner of that workplace and your staff is sick, they cannot go work, you're now going to run a loss, what do you call it? In your productivity is going to be lower, meaning there won't be, it will affect the economy. It is already affecting the economy. If one person gets diagnosed with TB, and I'm talking about DSTB, TB, drug sensitive TB, that person gets booked off for 2 weeks. First, sometimes people don't go to the clinic immediately. They're going to be sick first now. They're going to be at home because they are sick, missing a few days from work. Now, TB tests are being done. Find out you are now diagnosed with TB. You are getting booked off for 2 weeks. You can go to work only after 2 weeks. So look at all that time that you couldn't work, where there was no productivity at the workplace, meaning you are also affected. So that is why we all have to take part in this combat. As I said, the different stakeholders, again, not a health problem only. Remember, when you do household visits, you find that many of the people are unemployed. Many of the people, where you do the household, is the environment that they stay in. Some don't have a place to stay. Some stay in what do you call the water paper? These big water, I don't know, is it the water pipes, but those cement ones, those big ones that, where the water goes through and go and pour, somewhere else. But in that pipe thing, people are staying in there because there's no housing. There's not enough housing. So many people don't have a fighting chance. When we say fighting chance, we're looking at nutrition. You look at nutrition because you need to nourish the body. The body needs to be nourished, well nourished. When we talk about a fighting chance for this person to fight TB, if there's no food, if there's no work, you can't buy food. There's no proper housing. That is, again, it's not just a health problem only. Because social determinants, is that the right word, has an influence or fuel this disease, if I can put it that way. Yeah, so I'm pleased today to launch the Western Cape Government multi-sectoral emergency response plan to reduce the spread of TB in the Western Cape. Followed was commitment on World TB Day 24 March to report back on our fully fledged action plan within 1 month. I was joined for the launch by naming now all the people that was there, all the health department officials, civil society partners, and councillors, who else? Yeah, private and government, private and yeah, had to came together to work on this plan. We have formulated this response plan in recognition of the major impact which TB has on lives and livelihoods in our province. It makes an evidence-based and data-driven approach to slowing TB, ensuring that we apply the same energy to fighting TB from this point on as we did to fighting COVID-19 over the past year. So as I said, this was launched in 2021. So here they're talking about tackling TB, or the way or the strategy they're going to use, like they did with COVID. You remember what was put in place to combat COVID. You remember, all the measures that was put in place to progressively attack COVID. So now in this plan, they say they wanted to do it the same way as they did with COVID. The multi-sectoral TB emergency response plan was approved by PCAT on Monday afternoon ahead of today. Sorry, I'm just reading through, but you can read the full plan on the Western Cape website, Western Cape government website. Was approved. Speaking to the response plan co-chair, I'm excited by the gaps we've identified. This is not just a document sitting in the Premier's office, but a tool to be shared with NGOs and government. We have used the same approach to address COVID. Again, all the stakeholders, all the NGOs, the organizations working already in the different communities, because they are closer to the community while working in the communities. Member of remarked that I'm very happy and proud of what is coming about in the Western Cape. We were the first province to declare TB an emergency. National government has since been lobbied to follow suit. Yeah, we're not going to hang on to who said what or who's blaming who, who's blaming who, or who's doing what first. The aim is the end result, or the end user is the community member. It's the person that is exposed to this disease, which is TB. So it's not going to, the impact of TB on our healthcare system and economy. That is what I've mentioned earlier about the economy. The fight against TB is now more urgent than ever. Globally, it is estimated that the COVID pandemic has set back. As I said, please go and read this document. Otherwise, it's going to take me too long. But COVID was still fresh, in everyone's minds. Pandemic has set back the fight against TB by between 5 to 8 years and could result in an additional 6.3 million cases of TB between 2020 and 2025. So what happened during COVID, everyone remember, everything was put on hold and the focus was on COVID. Not on TB, not on HIV, not on other chronic diseases, your blood pressure, your hypertension, your diabetes, everything was put on hold. And the focus was on COVID. That is what that sentence is saying there. So there's that die agterstand wat nog moet ingehaal word. Anyway, waar is ek nou? Yeah, the reality is that COVID pandemic cut global efforts to respond to TB. We must now step up the fight drastically. In South Africa, the National Institute of, that's now NICD, highlighted that there was a 30% decrease in, okay, I'm not going to read all the stats. This is on top of an estimated that 42% of people with TB were already not being diagnosed and treated. So that happened during COVID. That these things fall through the crack. In the Western Cape, the spread of TB in our province has for decades negatively impacted the well-being of our residents, the healthcare system, and our economy. As I mentioned already, these consequences were amplified by the COVID-19 pandemic, especially during the highest lockdown levels. If we compare the period between April 2019 and against stats, we know that there was okay, I'm not going to do the stats. Please go and read this document. I'm giving you this background because I want to get to the part where these policies, it was implemented into policy. Policy was made about the activities that needed to be happen to support or to reduce the spread or to slow down TB, which has been implemented. That is why I'm anxious to get to that part. We care about addressing TB because it is a disease that impacts the most vulnerable in our society. I mentioned earlier things that also fuels the spread. The risk of TB is highest amongst people living in poverty. I mentioned that, who have poor immunity, including people who are HIV positive and who are either very young or old. The risk of TB transmission also increases with the closeness and the duration of contact to those already infected with active TB and the degree of infectiousness of the patient. So we will touch on that again. That will come to the implementation phase where but I don't want to confuse you now, but a close contact, if you know that you were in contact with someone that has TB, active TB, it can be at the workplace, it can be at home, it can be at school. You won't know if someone has a disease if that person was not tested, if there wasn't the results confirming that, or if the person wasn't diagnosed. So for a while, maybe someone is coughing, or someone maybe just have like flu, like maybe feverish, or and sometimes someone don't even have any symptoms. We will also get to that policy. It's getting interesting because in the past, only if you have TB symptoms, which is your coughing, weight loss, fever, chest pain, blood stained sputum, lethargic, tiredness, only then you were going to be tested for TB, where you give a sputum sample in a jar and it gets sent to the lab where they test for TB. But it's not only people with symptoms that has TB. People without symptoms can also be diagnosed with TB. That is why when you know you were in contact, if you, for instance, in the workplace, you're working with maybe a colleague in one cubicle, and go about your day's work, you're interacting, and then 3 days later, the person is booked off, your colleague is booked off, then they will let the manager or the person will then let the manager know that they were diagnosed with TB. Meaning, if I was working with my colleague in that cubicle or where we share space during our working hours, doesn't matter if I don't have symptoms, you qualify to get a sputum test. You won't be refused at the health facility when you say you don't have symptoms, but I was exposed. I was a close contact of someone that is diagnosed with TB. Then you qualify to also give a sputum sample without having symptoms. without coughing, having night sweats, drenching night sweats, weight loss and all that. Without that, you might have TB. That is why you must test. And studies that was done, the TUD study, I'm going to explain all that later. In 2019, it was found, it was proven, people that did not have any symptoms, their sputums were taken, and from of the clients or the patients, their test results came back positive for TB. So you don't wait for any symptoms. If you were exposed to someone with TB, close to someone, you ask for your TB test immediately. Yeah? I'm so off my page now. I mustn't mix but I'm getting too excited. We care about addressing. Oh yeah, we talked about the vulnerability. We talked about the contact. The Western Cape Provincial Council of AIDS and TB, which our co-chair has deemed this a crisis. Yes, it's a crisis requiring an emergency response. The Western Cape Department of Health cannot address these social ills alone. There comes that word, social ills. You can go to the clinic. You're going to get screened. Your test is going to be done. The result is going to come back. You are going to start on treatment immediately. Soon the result shows that you are positive for TB. The treatment is going to start. That is what will happen at the facility. If you are underage, remember we talked about nutrition, which is also important. So if you are not underage, underweight. If you are underweight and you start with your treatment, you do get a nutritional supplement at the facility. You do get a nutritional supplement until your weight peaks. That is why you have to do your weight monthly. Sorry, my eyes are on the time and now then I missed my point. So, So that is what the facility does. It has the resources to give you your medication, to do all the tests, to do, even x-rays. If it's part of testing, should you struggle to produce a sample. So there are those resources, but the health facility, they cannot, when it comes to social ills, then their hands are tied, meaning other stakeholders or other departments needs to take hands with the department. They need to take hands. When we talk about social ills, the things that's happening in our communities. Again, and we know social ills can be from... Okay, let me cut it short, sorry. I will come back to that because I do tend to get excited and then I get off the point. I will definitely come to that. Why we say other departments need to be involved. Like social development, DSD, social services, Department of Social Development, there's it. Department of Social Development. They have they're supposed to have like a front seat in this, the front seat. Where am I now? Social ills. That is why the response plan is an integrated and multi-sectoral effort. Effort to address TB. Addressing the social causes of health is a shared responsibility across programs and stakeholders within and beyond. Sorry, that was my dog outside. Within and beyond the health sector. That is what I was talking about. Much the same as with COVID-19, we all need to play a role. We all, almal. I'm thinking of what someone said to me once, so I don't know even now if this is going to fit into this, but it was an it was an jene kan ek nou nie by die woord kom nie. I think it's the dog that's distracting me. Official? Yeah. Like that is in a position to support. Ne? And this official said to me, health is not his problem. Health is the problem of province or provincial is a provincial problem. Those words cannot be used. No one can think that way. No one. Even the president himself can't say, health is not my problem, it's your province or your local. No, not even him. No one can utter those words that health, and especially this epidemic that we are in. You cannot dare to say those words. So those words took me back. I couldn't believe that someone in that position could say those words. But I did report it to the right channels, because in that position, you cannot have that mindset, because in that position that this person is in affects a whole lot of departments around him. Meaning if he has this mindset, he's not going to stick out his finger and help. Meaning the word is not going to get to these other partners and departments where he has direct access to. So how are the word going to get to if that person just said? So I don't want to stay on that, because now I'm even getting palpitations, because no one out there can use those words. It's not my problem. It's all of our problem. It is everyone's problem. I'm even having palpitations just by thinking of that specific incident. At the height of people dying of a disease that is curable. Lessons learned from the COVID pandemic. Okay, I'm not going to go through. Let me just quickly run through it. In responding to the COVID-19 pandemic, the province has proven its ability to formulate agile, innovative, and effective responses to health challenges. We have done this by adopting a whole of society and a whole of government approach. Yeah, that is also something that will be a separate video, separate from this one. The community and the government and that gap. That is a separate video. Where was I now? Yeah, our COVID-19 response has also shown us the power of combining a health system response with behavior change and whole of society support. We have now taken the lessons we've learned from our fight against COVID and adapted them to our TB response plan. We believe that through this plan, we can prevent TB infection, link TB positive patients to treatment more quickly, and ultimately save lives. As well as grow our economy. Remember, I talked about the economy. Grow our economy in the Western Cape. You will notice that this document is about Western Cape. But I'm also going to, attend meetings and workshops in Johannesburg, KZN, where these things are discussed. Because remember, we're dealing with the whole South Africa that having the problem. It's the whole of South Africa, meaning it's including all the provinces. But you will hear me say Western Cape, because this plan was drafted here, and this is the action plan that they had for the Western Cape. But when you go to Gauteng and KZN, they have similar action plans, not action plans, they have similar interventions. Yeah? That's why I'm saying it's the whole of South Africa. But this document I'm reading, it's the one that